tell me more. It's been 4 months now, you know. What kind of the problems that you were dealing with before you got the treatment?
So before I got the stem cell treatment, I was dealing with chronic pain to the point where when I was sleeping in the middle of the night, I would have to literally wake up and manually position my legs and turn my body because it hurt so bad. You know, I went on my honeymoon in June, I think I've said before, and I couldn't walk like more than a block without my knees being in pain. And it was just to the point where the options were continue with hydrocortisone and bupivacaine shots or a total knee replacement. And being a nurse, I know that the complications from knee replacements can be life-threatening.
Right.
Okay.
Right.
So for me, I always like to try different things and alternative things. And so when I saw Dr. Tam on Facebook, I like, okay, I'm going to go. Right. And so, 2 weeks afterwards, I was feeling great. I mean, the thing I noticed is I slept through the night. Right. And I wasn't in pain, and I didn't have to wake up to change positions. And then shortly after I got the injections, probably about a month, I started working with a physical trainer. And that's really helped me. And now I'm working with 2 trainers. One I'm working on with boxing and conditioning and stamina to the point where I can do 4-minute rounds of continuous punching and not lose my breath. So that's a positive. And then with the other trainer, who is a kinesiology-based trainer, she's working me with my flexibility and range of motion in my knees and working on changing my gait.
Wow.
And so now I can actually twist and pivot on the ball of my foot and not be in pain.
Right.
You know, I mean, I still wear braces to support when I do physical exercise just because the initial pain that I had when I first injured my knee years ago, and this was like in 1979.
Wow.
It felt like somebody had stuck a red hot poker through my knee and twisted. And so that's the pain that I remember, and I don't want to ever go back to that. So that's something that I do this with moderation and knowing my body and being communicative. And that's why I'm here letting Dr. Tam know what's going on, because you know, yes, it can be expensive to spend money on something like stem cells. But for me, the outcome has been very positive. You know, I'm active, I'm energetic, I'm sleeping. That's the big thing. And everybody knows your body needs rest to regenerate.
Right. Now, initially, were you I remember you and your wife were a little skeptical even.
Right. Especially my wife. My wife was really skeptical about it. Right. And I think that it's shown her that you don't just have to do traditional medicine. Right. There are different forms of medicine out there. And, you know, I had done research on stem cells before, a couple years before, and it was like, okay, but they're going to use mine. And then after talking to Dr. Tam about using your own stem cells versus the embryonic and the ability of the stem cells to do the work, I really did my due diligence on my research. And I think if anybody is going to take the time to do this and spend the money to do this, because that's always an issue for people, you really need to do your due diligence and see what type of product they're using. Is it a good product? Now, I didn't do the top of the line treatment. I did the one that I could afford, and I'm having fantastic results. But it's also following the rehabilitation program.
That's important.
That this man set up. Yeah.
A lot of people don't necessarily have one.
Right.
From what I hear is sometimes people go and do an injection, and then they say, all right, have a good time.
Right.
And I said, what happened after that?
Right. And those exercises, I mean, every day I was, even though it said 3 times a week, I was sitting there moving my kneecap, wiggling it to make sure things stayed supple, taking my knees and trying to bend them as far as I can, holding it for the 30 seconds and then moving it forward to a 90-degree angle. All of that stuff. I still do that. My job now is I work in a call center for a major hospital up here in Northern California, and I sit at my desk and I do that. I'll bring my knees back and then I'll straighten them out and get them to 90 degrees and, you know, just to keep them moving. But the rehab program that he has set up coincides with what my my second trainer is doing, and that it works really well together. And watching your diet, changing the way you eat,
right.
staying away from inflammatory foods, which
right.
is not easy
right.
to do.
And which is part of everything that
right.
we have initially.
Right.
That's part of the program, the supplementation.
Right.
All that, it's very, very complete.
Yeah.
So I'm glad you followed everything.
Yes.
Yeah,
I am, and and I'm still following everything. My final x-rays aren't for another couple of months.
Right.
But, I feel the difference in my body. And the fact that I'm able to be physical, and I can ride a stationary bike for 15 minutes and not have any pain, and bring my knees up high enough that when I'm leaning over, I can hit myself in the abdomen.
Right.
That's huge. That's a huge range of motion thing for me.
Right.
And that's because I took the time, I followed the directions, and I knew I was doing this for the right reason. I wasn't doing this for a quick fix. I was doing this because I was tired of being in pain.
Right. Well, Suzann, thank you so much.
Oh, you're
for
welcome,
following
doctor.
The directions and sharing your story. It's very inspirational, and that's why we're having Suzann share her story. So thank you so much.
Oh, you're welcome. Thank you, sir.
Absolutely.